Thank you, Dr. Caitlin, for taking the time to sit down and interview with me today.
Of course.
We do appreciate, first of all, we appreciate your business, and we appreciate you allowing us to come down here and interview.
Of course.
So tell me a little about you, okay? You know, where you went to college, where you went to chiropractic school, you know, family life, what your hobbies are and your passions are.
Okay. So I have my bachelor's degree in athletic training that I got from Northwestern College in Orange City, Iowa. After that, I went and got my master's degree in teaching from Hastings College. And then after teaching for a few years, went back to chiropractic school and went to Palmer College of Chiropractic in Davenport and graduated in 2022. So that's where I went to school at. Some more about me. So I have a daughter named Emery. She's just turned 1 last week. I'm married to my husband, Logan. We've been married for almost 9 years now. We have a dog, Midas, who we love and adore. He was our first baby, technically second baby. And then some of my passions. So I am an avid reader. I love to read. I love to watch movies. I love to be outside with my daughter and my dog. I actually ended up going back to school for animal chiropractic because I love animals as well.
Interesting.
Lot. Yep. Hanging out with my family, being close to my family. My family is mostly in the Oceanside area where I'm at. And so it's nice being home and being close to everybody.
Oh, cool.
So.
Well, Davenport, Iowa is a great town. We have one of our customers, good customers, is Dr. D's.
Okay. Yes.
We work a lot with Dr. D's and his team.
Very cool.
So we participate in all of his CBT conferences where
Very
we just
cool.
spent recently time in with him, and Mike and I both, Dr. Mike and I both were there for the conference and learned a lot of things. Things that went over my head, but
absolutely, I understand.
and it was fun. So you just started your practice.
Yep.
You just opened up.
Yes.
And how exciting time is this to be doing this?
Yeah, it's very exciting. It's definitely nerve-wracking, but I'm very excited to be open to have this space to be able to serve North San Diego County. There is, that I know of, no one in North San Diego County who does chiropractic with a cone beam with a digital x-ray as well. So very excited to be able to serve my community in this way.
Okay. Now, you just recently purchased from Maven Imaging the standard chiropractic x-ray system with a tube and a wall plate and a digital, but you stepped it up. You stepped it up to something different out of the box with a CBCT 3D imaging.
Yes.
How exciting is that?
Very.
I mean, very few people invest in doing something like that. Why did you decide to incorporate both?
So I have seen how much CBCT can enhance what we do as chiropractors, especially in the upper cervical region, because that's one of my specialties is Blair chiropractic, so upper cervical. So being able to see in 3D, you can get so much more information. You can get a lot more background. You can see, there's just so much more you can see. And so when you incorporate a 3D image, one, you're instilling more confidence in your patient because you're like, hey, let me just turn this image and show you what I'm looking at. But you're also saying, hey, I see this, 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 and this. It's not the end of the world. We can help. And that helps instill confidence.
Okay. So what patient populations do you primarily serve? What age group? I mean, you know, I'm a retiree type person. Where do you see your marketplace here in Oceanside?
So being a new mom myself, I will probably see more people around my age. But at the practice that I was working at, because of what we do in the neck, we saw a lot of your patients who had neck pain that wouldn't go away, who were at their wit end, who had dizziness or vertigo or, well, that's similar, migraines, trigeminal neuralgia, some of your more complicated neurological patients who couldn't find another answer. And they're like, well, I may as well try chiropractic. Let's see what happens. And we got great results with them. And a big part of that is because we had 3D imaging to be able to know what's happening further than just a digital x-ray.
What convinced you to do 3D imaging? Where'd you get this passion to include this into your basically treatment program?
Yeah, so when I was in chiropractic school, I had a come to Jesus moment because I had never had migraines in my life, and I had migraines and dizziness constantly when I was in about my 5th trimester, which is about halfway through and it just wasn't going away. And it started in first trimester. So almost 2 years of suffering with these dizziness and migraines that wouldn't go away. And I was getting chiropractic care and I was getting worse. And I was like, oh my gosh, I've done the images, I've done X, Y, and Z, and I'm just not getting better. And so I was having a hard time because I'm like, I am doing chiropractic for my life. I believe in this, and yet it's not working for me. And so I contacted who I had previously worked for about interning. And so we did a 3D image. She also has a 3D CBCT, and we saw that my neck is actually quite unusual. Anatomically, I have bone that spurts out from my top vertebra and attaches to my skull, which you can't see on a traditional x-ray. So each time we're feeling and adjusting these bones that can't move. And so without that 3D image and without the technique that I do, I wouldn't have gotten better. I would have continued to get worse. And so having that 3D image literally changed my life and changed my view on chiropractic in a sense of I changed completely what I was doing. I didn't believe in upper cervical chiropractic care, and then it was like, this is the way to go. You have your 3D image, you're able to see what a traditional x-ray series can't see, and you can do more things. You can help more people. You can accept cases that are at their wits' end and don't know what else to do. And so myself being my own patient zero of, hey, this works, this is effective, I need this to be able to effectively treat more people. So it was worth the investment for me because I've seen and felt how worth it is.
Well, thank you. So who was your mentor? I mean, you mentioned the doctor, but you didn't tell me your name.
Yes, so Dr. Elizabeth Hafer and then also Dr. Whitney Bolton. I worked for Dr. Elizabeth Hafer, and then Dr. Whitney Bolton was an associate at the practice. And so I worked very closely with both of them, and they both taught me incredible things about chiropractic, but about Blair in general, about doing the 3D images, and yeah, so
perfect.
Both of them.
So Dr. Mike,
yes,
he's one of our salesperson.
Yes.
What did you think of the experience from Dr. Mike, since he is a chiropractor?
Yes.
Okay.
Yes.
How was your working experience with Mike?
It was great. It was fantastic. He was able to answer all the questions that I needed. He was on my timeline, which I appreciated as I was, I'm going to open the practice. Oh, maybe not yet. Oh, wait. And so he just kind of was with me every step of the way, trying to figure out, what what do I want and at what timeline do I want it. So he was kind of pivotal in that, trying to arrange everything with me.
Well, perfect. Well, appreciate you those kind words about Mike.
Yes.
So Maven Imaging,
yes,
is a family-run business. How was your experience working with not only with Mike, but the people in Chad Hutchison, who's the other owner, and his wife Jen, and of course me, I'm Mike Hutchison.
Yes.
How was your experience working with these people from the time that Mike first called you to the final installation guys where we had Tony and Doug down here working together? How was your experience with Maven Imaging?
Fantastic. Absolutely wonderful. You guys were answering all my questions. You guys, called me, hey, this is what's going on. We had snafus that were not anyone's fault. And so it was you guys kind of eased my anxiety when it came to that stuff of, hey, it's okay. We're going to be back in the next 2 days when it gets here. We'll make sure everything, you guys have been fantastic in all that you've done to ensure that, even from, drawing up my radiology room to make sure that I have all the things that I can submit it to the County of San Diego, that I have X, Y, and Z, the physicist report, things that I wouldn't even know that I needed. You guys had my back. You guys set everything up, made it so easy.
Well, thank you. So can you share a couple case examples? Of course, I think you already did that in a little way with the CBT with your own treatment.
Yes.
But when you were working with your mentors, do you have a couple of examples of a patient where when they came in, they walked in, they're in pain?
Yeah.
People come to chiropractors because they're in pain.
Yes.
People want treatment. If you don't have an x-ray system or you don't have some kind of terminology to look at inside the body, what happens?
People a lot of times don't get better. And then that's where the chiropractors or quacks come in, because they're like, well, I'm not getting better. Well, have we looked at it yet? I actually am making a sign, and I've seen it around, but it's, to see is to know, to not see is to guess. And we want to see, we want to know what's going on, because that's how we can best help. So I had a patient who at my other office was not getting better. Finally came to us. We did the 3D image, we did regular x-rays, and it took a while because there was some degeneration, more than some degeneration, but within 6 months, pain-free, completely pain-free, on a wellness plan, feeling much better. But it's important to be able to have those images so we can help. And then there's other people with, oh, my low back's not getting better. Even with the treatment that we're doing, it's not getting better. Well, let's take a look at it. Let's take an image and see what's happening. Well, if that bone is shifted forward and we're placing blocks in a way that is continuing to shift that forward, then we're not doing our job correctly, right? So we want to actually see what's it doing so we're not damaging, right? We're actually helping what needs to be helped. So
perfect.
Yeah.
How do you educate your patients for the benefits of advancement in imaging?
Yes.
But also, how do you educate them on why they need your services?
Yeah, so once they're here, that's the fun part for me. Once we take the images, going over the images with somebody is my absolute favorite part. I always send my images to a radiologist. So once I have a radiologist report, I will go over those images with my patient, and I can literally pull up the 3D image. Hey, this is where you have degeneration. You see this, you see this. Hey, this is cool, unique. We wouldn't be able to see this on an X-ray. Do you see how this ligament is, what's the word I'm looking for? Is calcified, right? Stuff like that. So looking at all the intricate things based on the radiology report that we have. So that's my favorite part, is actually going over those things with patients. And once they see it, they're like, oh, I never knew that. Or I had a patient the other day who you can't rotary adjust her neck. So you can't twist the neck to adjust. We don't twist the neck to adjust, thankfully. But she's been to other chiropractors who don't do imaging, and they're twisting her neck. And that could honestly significantly hurt her. And so we have the images now, and we can see that, hey, so we were chatting about it the other day of, hey, you shouldn't ever go to a typical chiropractor anymore because your neck can't be adjusted that way. So patient education in that way, by being able to pull up the image, show them what's going on, have the radiologist report, and the combo of both. And then, oh, go ahead.
No, fine. Well, you've answered the questions great, okay? But how many times do you stop and say, hey, let's reevaluate?
Oh, yes.
What's your workflow with patients?
Gotcha. Okay, so typically with the neck, we don't want to have to re-image unless there's a trauma. However, we found that about every 2 years or so, things change, right? The body changes and adapts. It moves in the way it functions, right? Different traumas can throw it out in different ways, right? And so what we're finding is some people can hold for 15 years, right? We adjust their neck and we don't have to adjust them again for 15 years, and that's amazing. It's incredible, right? Wouldn't
Never
that be
heard that
wonderful?
before.
I know, but we have patients who are like that, or I've worked with patients who are like that. And then you have other people who their neck just doesn't want to hold that adjustment. So if you have somebody who's holding, and then all of a sudden they come in and they're not holding, and then the next visit they still didn't hold. All right, well, it's time to re-look at it and see what changed, because more often than not, something's changed and we need to adjust them in a different way. But we can't do that unless we have the images. And so the answer is tricky because it depends on your patient.
Okay.
And so, some people might need images once a year.
Okay.
Some people might never need them again, but it just kind of depends on what's happening in their life and how their body is adapting to the chiropractic that we do, the Blair Chiropractic.
Well, perfect. It's a little early right now, but I'm going to ask you, financial return on the money that you spent.
Yeah.
I mean, you obviously spent twice as much money as most chiropractors do on technology.
Yes. Projections wise, I should be able to pay it off in 2 years. Projections. Whether or not that happens, you never know. But I have faith in my ability, and honestly, the fact that we have those images makes us that much more valuable because we're able to do more, because we have the ability to do more. So I don't see an issue with my return on investment. That's why I went with it, because I know how beneficial it is.
Well, thank you. Mm-hmm. So, since you've invested in it,
yes.
What do you think other chiropractors? Let's put it this way: chiropractors do not like to spend money.
No, not at all.
But they need imaging to do their jobs.
100%. Yes.
Do you think it's worth investing for other chiropractors? Because there's different type of chiropractors. So you're a specialist, okay? Yes. So you got your 100% chiropractors. You've got these other all other types of brand chiropractors out there in the industry. Do you think they should invest in that, or you just think they're not giving the best to their patients?
That's a tricky question. Because my answer is it depends, which is everybody's favorite answer. I think every chiropractor needs to have some sort of imaging, whether 2D, 3D, some sort of imaging needs to be had. people need to see what they're dealing with. I think once people aren't getting better, or if somebody's not getting better, okay, then it's time to either refer to somebody who has a 3D imaging machine, or even sometimes an MRI, get an MRI, or invest in one yourself, depending on what you do, again. So I know for me, it's important, the upper cervical world, I think it's so important to be able to see in 3D, because you can just see so much more. You can do so much more. You can get so many more listings because you can pull it in tiny little slices, right? Something that I see in an X-ray, I'm like, okay, that's gone forward for sure. When in actuality, I pull it up on a CBCT, I'm like, nope, totally gone back. But who would have said? I wouldn't have seen it if I didn't have 3D image. Okay. So you can do more. So again, comes back to, it depends on what you're doing, but every chiropractor should have some sort of imaging capabilities.
So now we're going to go back to, because before we started this interview, we were talking about social media and marketing and your approach to that. How do you think you're going to reach out, and what kind of people are you going to be looking at? Car accidents, personal injuries, sports injuries. You mentioned about vet imaging and vet chiropractic and things like that. What do you think? What is going to be your best tool to get out there, and what do you need to take it to the next level to become an influencer in the marketplace? Tricky question.
It is a tricky question, because a big answer is I'm not sure yet, because I don't know what works and what doesn't, because I'm so new to this. My goal is to definitely use the 3D image as a marketing tool, because it's, again, I am, from what I know, the only chiropractor in North County who has a CBCT. So I think that's going to be really important. The next closest is San Clemente, and then the next closest is San Diego. So I'm kind of in that 45-minute range between two offices who have it. And so I think that's going to be a big part of my marketing, is using that CBCT and saying, hey, I specialize in this, I can help. So you were asking about like PI and sports. So being an athletic trainer, sports is near and dear to my heart. I also played sports in college, so that plays a role into it as well. But dealing with athletes is what I still do with the athletic training degree that I have. And so sports injuries, I would love to work with sports. It's actually one of my niches is sports. PI cases, I am more than happy to take PI cases. I have a law firm that I will work with to do PI cases, who I've worked with when I was up in Orange County still. But that's not all I want to do, because the general population has issues as well, right?
Well, sports, I'm an athlete myself.
Yeah.
From the ages 4 or 5, I was learning how to play baseball and stuff like that. But I've generated a lot of trauma to my body.
Yes, 100%.
And the trauma in my own personal body is still there.
Right, absolutely.
Which is sad. Yeah. But at the same time, you're not aware of this when I was a younger kid, what kind of techniques and things could have helped with the trauma. So
absolutely.
And so I'm dealing with that with my own personal things. So.
Well, and that also goes into being able to market it, because a lot of people are like, well, I don't have pain right now, so I'm fine. And then I see them 20 years down the line, and they have all this degeneration because of injuries that happened when they were 20, and they didn't stabilize. So for me, they didn't stabilize their neck. And so what does the body do to be able to create stabilization? It builds bone, which is arthritis. And so getting word out before the arthritis happens is important. But again, if people aren't in pain, they typically are like, I don't need a chiropractor, I'm not in pain, right? So I think it's important. Patient education is important as well, of just because you're not in pain doesn't mean there's not an issue. And typically you don't know there's an issue until we're way past it.
I understand that. Mm-hmm. One of the things that I was at in Des Moines, Iowa, with Dr. D's seminars up there, and he was doing an education with a bunch of CPT doctors. Yeah. And they talked about personal injury and automotive accidents and stuff like that. And majority of the time, people who get in a wreck or something like that, I'm fine. I don't want to go to the hospital and stuff like that. What would you say to somebody that said, hey, I just was in an auto accident, what should I do? Yeah,
100% get imaging in general, because typically there's some sort of whiplash happening. Because whether you get hit from the front, back, side, right, your body is doing some amount of whiplash, right, which stretches those ligaments out, which creates the opportunity for instability. And again, how does the body stabilize itself? It builds more bone, which leads to arthritis in the future, right? And so that car accident 20 years ago is causing you to not be able to move your neck because it's fused with arthritis later down the road. So if you get yourself fixed up and ready ready to go when you're 20, it's not going to affect you as badly when you're 40.
Okay.
Right? So I think it's important for them to, one, go to the hospital, make sure they're okay, depending on how bad the accident was, but see a chiropractor, right? Stabilize your neck and make sure that this doesn't become a problem later in the road, specifically an upper cervical chiropractor, because you're dealing with a lot of
It's a great answer.
nerves. So
you've got 2 x-rays.
yes.
In an automotive accident with whiplash.
Yeah.
Which tool would you use?
Both.
You'd use both.
I would use both.
What's going to provide you the best answer?
Both, because so they're 2 different tools for 2 different reasons, right? So with a traditional x-ray, we can do flexion and extension views, so we can see if there's ligament issues, but with a 3D, we're able to see stationary, right? What has gone which way, where, what, how, why, and is it affecting the nerves, right? Obviously MRI is for nerves, but you can still see if there's stenosis, if there's narrowing in that canal. So both have a use. And so a car accident injury, yes, I want to see in 3D what's the neck doing, especially after an injury, but I also want to see, is there something further that, hey, there's now instability in the neck? Because if there's instability, then that's just a step further of issues that we need to be able to address. But if we don't know there's instability, especially like a traditional chiropractor who's going to twist and crack your neck and it's unstable already, we're just creating more issues. Now with Blair, we're not twisting and cracking the neck, thankfully, so less issues, but we still need to know if there's instability there, right? Because that's going to totally complicate the case.
Okay.
So.
Well, perfect. Would you recommend Maven Imaging to other chiropractors?
100%. Okay. Yeah. Don't even need to finish that question. I recommend you guys. I'm pretty sure I've already recommended you guys to other chiropractors.
Well, thank you very much. So what I'd like to do is we go into your x-ray room.
Yeah.
And I'm going to take some pictures of the
Sounds
x-ray room and things like that. But I would like for you to, since we have the camera and the videos, is just actually talk about when you're going in and with the 3D imaging on how that works.
Yeah.
Actually, video. You can use me for a guinea pig.
I was going to say, you want me to do a 3D image on you?
Let's do a 3D image, and
I love it.
And let's walk through it. Let's record it.
Yeah.
Let's talk. As we do through this, let's walk through the whole process.
Absolutely.
And
do you want to see the analysis too?
Huh?
Do you want to see the analysis too? So you can.
Absolutely.
Let's do it. Okay.
Let's come up with the correct answer.
I love it.
But treat this as like you're training a tech.
Oh, okay. Sounds good.
Let's walk through the process.
Yeah.
Treat it like you're teaching somebody.
Love it.
Maybe better is how do you educate your patients while you're taking this image?
100%.
And why are you doing this?
Yes.
Okay?
Let's do it. Okay.
Perfect. Let's do it.
Let's do it. So, here's your 2D image. Looks fantastic. We definitely have some degeneration going on. That's okay though, and a little bit of a reverse curve. So we want our curve to go this way, and yours is going this way. And then it was left, so we always want to make sure, I'm just gonna come in here, and it was neutral. Perfect. Okay, and now we come over here. Okay, so this is just the preview of it, but we can see your neck in 3D, and we can see up to your jaw, and we can even see some of your eyes, like your cheekbones are right here, your teeth, your hyoid bone or your Adam's apple, and then your thyroid cartilage, which has calcified a little bit, which is typically stress related.
I have no stress.
I wouldn't think so. And then this is a top-down view looking straight down. So here is a vertebra, your teeth, and then your throat. So now let's go look at it in real time, where we can play with it and move it. Sound good?
Mm-hmm.
Okay. All right. So our CS3D is how we load our 3D image. Our 2020 is how we load our 2D image. So 2 different ones. So we're gonna take away the plane so we can see it better, and we're just gonna format it so we can see better. So we're gonna take away some of the flesh, and we're gonna add some bone. There we go. So now we can pull this up, and here's your lovely neck. So we can scroll in on it and really get an up close look at it. You got some definite arthritis happening. This one's gone backwards on you. That's fun. And then we can also, so besides just the 3D, so we can look at it from the back as well. So you have a little bit of a curve here.
Looks like it's crunching on each other.
They are. That's the arthritis. That is, so see how it, well, the right side's not as bad as the left side, actually. The left side's much worse.
No, that's where I have a lot of pain.
Well, that makes sense then. That makes sense. So see how crunched and almost fused this is? That's arthritis because your body wants to be stable, right? So we are going to come in, correct it, and stabilize it. But we can also look at thin slices. So here is where we can see how thick the slice is. So we can look at it as if it's an X-ray, which is cool. Or we can look at it on very thin slices. So let's look at the left side of your neck. So your C2 is totally fused. There should be a joint here, and you don't have a joint there. So that's cool that we can see it, because if we pull this up to a traditional X-ray, it looks like there's a joint, because there might be one on the other side. Does that make sense?
Mm-hmm.
So it's cool because now I know, hey, I can't adjust that one because it's totally fused. So C2 fused, this one. So I'm just scrolling through to see the end of the joint to see what it's done. So I'm just going back and forth to see what each joint has done. So this one has gone forward. This one has gone forward. This one has gone backwards. So this is what I'm doing. I'm looking at each and every individual joint. And then because we don't have C7, we can pull up our 20/20. So then 2, 3, 4, 5, 6, 7. Okay, so now we're looking at the joints. But see how much more difficult this one is to read? So doable. Here's joint 1 and joint 2. It's just a little bit more difficult. So it takes more time.
When you take a look at the X-ray,
Yeah.
the X-ray doesn't provide the same kind of definition that you get with the CT scan.
Correct.
The CT scan is actually going to show you, because if you pull the study image
Yep.
down and look where C2 was, so you see C2,
Yep.
it looks like it's fine.
Yep, it looks like it has a joint here, which it probably does on the right side, but the left side has no joint. Even if I have no images at all, I'm gonna feel that and I'm gonna say, hey, that's stuck, that joint's not moving. I'm gonna put a little thrust into it and get it to move. Well, that joint's never gonna move because it's fused together, right? So if you don't have imaging, you're making things much, much worse because you're putting a thrust into something that doesn't move.
So the importance of this particular image compared to a CT, this shows you the neck looks fine from this side.
Yes.
Or actually,
So
it
you can see-
looks like there is a space between
Yes.
C2 and C3.
Yes.
But in reality, it's fused together because you can see that in the CT scan, as you
Correct.
can see here.
But if we go to the other side, this side has a joint.
Okay,
So I can adjust the right side, I just can't adjust the left side, which we
that's
can do.
amazing.
I know, right?
Because normal chiropractors would not be able to see this definition,
Correct.
and so they would be able to diagnose this, but at the same time, is it a correct diagnosis?
Correct.
Or do they realize that they really can't put a treatment on that one on
Right.
the left side versus
Exactly.
the right side? There's no way to break that calcification up and
There is
that
not.
arthritis out of my
Correct.
neck.
Correct. However, we can stop it from getting worse. So you know how if I come back to this side, how this is getting narrow, this is getting narrow, they're all starting to get more narrow. What we can do now is we can prevent these from becoming this
How do you prevent that from
by
becoming-
stabilizing your neck. So remember when I said we have people holding for 15 years? That's because their neck is stable, right? So by doing the Blair upper cervical correction, I don't want to adjust your neck every single visit, right? I want your body to be able to stabilize it and hold it so it doesn't build more bone, creating more arthritis, right? We create more arthritis and we are at risk of this happening. So what we do is we stabilize it, we get your head on straight, literally, right? So your body doesn't continue to build more bone, creating more arthritis.